Have you ever wondered why healthcare costs are skyrocketing? It's a question that's been on the minds of many, especially as we continue to witness the steep rise in treatment costs. The cost of cure, it seems, is becoming an increasingly heavy burden for many to bear. Let's talk about our healthcare expenses. We're not just talking about the occasional doctor's visit or prescription medicine. We're delving into the realm of chronic illnesses, long-term diseases, and the staggering costs associated with treating them. These are the conditions that can drain a person's savings, leave families in debt, and create a financial strain that lasts for years, even decades. To illustrate this, let's consider a real-world case study. Picture John, a man in his 60s who was diagnosed with a preventable chronic disease. John had to undergo multiple surgeries, numerous rounds of medication, and countless therapy sessions. The bills piled up, and before he knew it, his life savings were dwindling at an alarming rate. The cost of his treatment was exorbitant, not to mention the emotional toll it took on him and his family. This is not an isolated incident. There are millions of Johns out there, shouldering the high costs of treatment for diseases that could have been prevented with early intervention and lifestyle changes. The financial burden is immense, and it's causing a ripple effect on the economy, driving up healthcare costs for everyone. It's not just about the money though, it's about the quality of life. It's about the pain and suffering that could have been avoided. It's about the years of life that could have been lived fully, without the shadow of disease looming overhead. As we delve deeper into this topic, we'll explore the ways in which we can shift our focus from curing diseases to preventing them. We'll uncover the surprising reasons why prevention is not just beneficial to our health, but also to our wallets. So, as we see, the cost of treating a disease can be overwhelming. But what if we could prevent it in the first place? What if we told you that preventing diseases could be more cost-effective than treating them? Yes, you heard it right. Prevention is not only better than cure, but it's also less expensive. Let's dive into our first reason: early detection and intervention. Imagine a world where diseases like cancer are detected at their initial stages. This isn't just a hopeful vision, it's a reality that is becoming increasingly possible thanks to advancements in medical technology. Early detection of diseases, particularly those that can evolve into serious conditions, is a game changer. And here's why. Consider, for instance, the case of breast cancer, one of the most common cancers among women worldwide. If detected early, the 5-year survival rate is a staggering 98%. Compare that to a late-stage diagnosis where survival rates plummet to a mere 26%. But it's not just about survival rates. The financial implications are equally staggering. Treating early-stage breast cancer can cost between $20,000 to $40,000. That might seem like a lot until you consider the cost of treating advanced-stage breast cancer, which can skyrocket to over $250,000. That's more than 6 times the cost. Plus, this doesn't even account for additional costs like lost wages, travel expenses for treatment, and the emotional toll on patients and their families. Early detection isn't just about mammograms and doctor's visits. It's about creating a healthcare system that prioritizes prevention and early intervention. It's about investing in research and technology that can detect diseases before they become advanced. It's about educating people on the importance of regular checkups and screenings. And most importantly, it's about understanding that an ounce of prevention is worth a pound of cure. By focusing on early detection and intervention, we can save not only lives but also a lot of money. So, early detection and intervention can save not only lives, but also a lot of money. Did you know that your lifestyle could be making you a frequent visitor to the doctor? Let's delve into the second reason why prevention is cost-effective: lifestyle changes. Our daily habits, the choices we make, can have a profound effect on our health and, by extension, the amount we spend on healthcare. Consider the case of John. A few years ago, John was overweight, a smoker, and neglected physical activity. His diet was high in processed foods, and he was fond of his evening cocktails. He was a frequent visitor at his doctor's office with recurring health issues like high blood pressure, prediabetes, and respiratory problems. The bills were stacking up, and the frequent doctor visits were disrupting his life. John's doctor suggested a change in lifestyle. He was advised to quit smoking, reduce alcohol intake, start exercising regularly, and adopt a balanced diet. The transition was tough, but John was determined. Slowly but surely he began to see changes. His weight dropped, his blood pressure normalized, his respiratory issues improved, and his prediabetes reversed. Fast forward to today, John's healthcare costs have significantly dropped. He rarely visits the doctor, and his overall health has improved immensely. His case is not unique. The Centers for Disease Control and Prevention states that 4 out of 5 of the most costly adult health conditions, heart disease, cancer, respiratory diseases, and diabetes, are preventable with lifestyle changes. Making such changes does require effort and commitment, but the payoff is substantial. Not only do we feel better physically and mentally, but we also save money that would otherwise be spent on treating preventable diseases. Plus, the cost of prevention, like gym memberships or healthier food options, is often less than the cost of treatment. Moreover, the benefits of lifestyle changes extend beyond the individual. They reduce the strain on our healthcare system, freeing up resources for those who need them most. So, think about it. Could a few changes in your lifestyle be the key to better health and lower healthcare costs? Adopting a healthy lifestyle not only keeps you fit, but can also keep your healthcare costs down. Can a simple vaccination save you from a hefty medical bill? The answer is a resounding yes. It's time we delve into our third reason why prevention is cost-effective, and that's vaccinations. Let's consider a real-world case study to illustrate this point. The story of the measles vaccination in the United States is a compelling one. Prior to the introduction of the measles vaccine in the early 1960s, nearly 4 million cases of measles were reported annually. This wasn't just a health crisis, it was an economic one as well. Consider the cost of treating each case, the hospital stays, the doctor's fees, and the medication. Then think about the indirect costs. Parents missing work to care for sick children, the long-term health issues that could arise from a measles infection. These costs quickly added up, and the burden was largely shouldered by the healthcare system and the families affected. Then, in 1963, the measles vaccine became widely available. The result? The number of measles cases plummeted. By the year 2000, measles was declared eliminated in the United States. The economic impact was staggering. An estimated billions of dollars were saved in healthcare costs alone. But the benefits of vaccination extend beyond the individual. Vaccinations protect not only the person receiving the vaccine but also the community at large. It's a concept known as herd immunity. When a high percentage of the population is vaccinated, it's harder for a disease to spread, protecting those who can't be vaccinated due to age or health conditions. So the cost savings from vaccinations are twofold. They save individuals from potentially high medical costs associated with treating diseases, and they reduce the overall burden on our healthcare system. In the grand scheme of things, the cost of a vaccine is relatively small compared to the potential cost of treating a preventable disease. And it's not just about the money, it's about the quality of life, the peace of mind that comes from knowing you're protected. Vaccinations, therefore, are a cost-effective way to prevent diseases and save on healthcare costs. So, how does prevention really impact your healthcare costs? Let's take a moment to dive into the economics of prevention. We've discussed how early detection and intervention, lifestyle changes and vaccinations can significantly reduce healthcare costs. But how does this all translate into dollars and cents? Firstly, early detection and intervention. When diseases are caught early, the cost of treatment is often considerably lower. Think of it as fixing a leak in your house before it floods your basement. The cost of a plumber is minimal compared to the damage a flood could cause. Similarly, catching a health issue before it escalates means less invasive treatments, fewer hospital stays, and ultimately, lower healthcare costs. Secondly, let's consider lifestyle changes. It's no secret that maintaining a healthy lifestyle can keep you out of the doctor's office. Regular exercise, a balanced diet, and avoiding harmful habits like smoking or excessive drinking can significantly reduce the risk of chronic diseases. Lower risk means fewer treatments, fewer medications, and fewer doctor visits. This can result in substantial savings on healthcare costs over a lifetime. Lastly, vaccinations. These are one of the most cost-effective health interventions available. They prevent diseases that would otherwise require expensive treatments or hospitalizations. Take, for instance, the flu shot. It's much cheaper to get vaccinated than to pay for antiviral drugs, doctor's visits, or even a hospital stay if the flu takes a severe turn. Now consider these cost savings on a national level. If every individual took steps to prevent disease, the collective savings could be monumental. This could free up resources for other crucial areas of healthcare, or even reduce the overall cost of health insurance. In conclusion, the economics of prevention are simple. It pays to take care of your health. Not only can it save you from pain and discomfort, but it can also save you a significant chunk of change. Prevention, as it turns out, is not only a healthy choice but also an economically smart one.